Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. 5 ways that medications particularly affect anyone over the age of 65, and we don't think about this anywhere nearly enough. When I work in the hospital, the vast majority of my patients are over the age of 65, and I wish that more emphasis was put on this to avoid disasters occurring. Because as any individual ages, their body undergoes various physiological changes that can significantly alter how medications affect them. These changes can impact the effectiveness, side effects, and overall safety of medications in older adults. Well, yes, indeed, and I can't tell you over the years how many horrendous things I have seen happen to older adults who are inappropriately prescribed medications which are simply way too strong and not enough thought has been put into. That's an understatement. Thought being put into how the medication will directly affect anybody's systems, interactions with other medications, and it has led to some severe side effects and adverse events. This happens to millions of older adults out there, and I want to focus here on 5 particular things that we should be thinking about more. Number 1, altered pharmacokinetics. The way the body absorbs, distributes, metabolizes, and excretes drugs, known as pharmacokinetics, changes with age. Older adults often have decreased gastrointestinal motility and blood flow, which can slow the absorption of medications. Additionally, changes in body composition, such as increased fat and decreased lean body muscle mass, can affect the distribution of drugs. The liver and kidneys responsible for metabolizing and excreting medications also tend to function less efficiently with age, leading to longer half-lives of drugs and increased risk of accumulation and toxicity. Number 2, increased sensitivity to medications. The truth is that a 65-year-old's body will never be the same as a 25-year-old's body. Aging can make the body more sensitive to a wide variety, if not all medications. For example, older adults are more likely to experience stronger side effects from sedatives and pain relievers. I see that all the time. This increased sensitivity can be due to changes in receptor sensitivity or a decline in homeostatic mechanisms. Consequently, standard doses may be too high for older adults, necessitating careful dose adjustments to avoid adverse events. Number 3, higher risk of drug interactions. Older adults are more likely to be on multiple medications, increasing the risk of drug-drug interactions. You can say that again, I see that all the time. Polypharmacy, which is taking multiple medications concurrently, can lead to adverse interactions, where one drug affects the effectiveness or toxicity of another. This risk is compounded by the use of over-the-counter medications and some supplements, which can also interact with prescription drugs. Number 4, changes in drug tolerance. Over time, older adults may develop a tolerance to certain medications, requiring higher doses to achieve the same therapeutic effect. This is an important point. You have to be very careful when going up on medication dosages. Conversely, they may become more susceptible to side effects of other drugs. For instance, drugs such as anticoagulants can become more problematic as the risk of bleeding increases with age. Number 5, a significantly increased risk of other chronic conditions. Many older adults have multiple chronic comorbidities, including diabetes, high blood pressure, and arthritis. These conditions can complicate medication management as they may require complex treatment regimens. Additionally, chronic diseases can affect how drugs are processed by the body. For instance, heart failure can reduce blood flow to the liver, affecting drug metabolism. So those are some factors to keep in mind over the age of 65. Why medications have to be used with more and more caution with each passing year. And this is such a tragedy. I've talked about it before. Deprescribing, those terrible medication lists. I believe that was a title to a previous video, which a lot of people found helpful. But the chances are, when you look at statistics on prescribing in over 65s, which is almost everybody over the age of 65 on a prescription medication these days. If you're over the age of 65 and aren't on a prescription medication, then congratulations. But the chances are that you know somebody who is on prescription medications over the age of 65. And a massive proportion of these are on way too many pills. It's horrible to see people who've worked hard their whole lives, have contributed so much to society, now drugged up beyond belief. And hopefully you have access to a good doctor who can regularly review your medication list and successfully deprescribe some of these medications, because with each passing year this becomes more pertinent. As the body becomes more sensitive to medications, many medications, the dosages need to be decreased, and in many instances medications can be stopped completely as people get older. So it's really important to not let anything slip through the net. Remember, Big Pharma is making a ton of money from our older population, and in lots of circumstances the medications end up doing more harm than good. Please be careful out there. Thanks everyone for watching. Feel free to comment down below. I enjoy reading all of your comments. Check out my free guide, 10 ways to stay away from doctors with a focus on metabolic health. That link is down below, as are the links to my website and my free newsletter. Take care everyone, stay strong, hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again next time.